Good afternoon, buenas tardes to everybody. My name is Armando Rendon. I'm a member of Mexicanos 2070. That's Mexicanos 2070. And uh, welcoming you to our monthly webinar, which today is going to feature the topic of the impact of COVID-19 on Latinos, Chicanos, and people from all over the world we call ourselves Latinos. And it seems to me that's one of the issues that we're going to talk about, what we're called and how we're identified in this pandemic. We're going to have with us two persons, Dr. Rogelio Saenz, whom I'll introduce in a moment, and we expect a Dr. Julian Perez, who's an MD, to join us around 12:30 or so. I'm saying that with one caution that he is on the lines. He is a practicing physician at CMAR, California Community Health Centers in Seattle, Washington, and he hopes to have an opening in his schedule from treating people with COVID at around 12:30. So hopefully he'll be able to join us. Right now, let me say something about Dr. Saenz, who is a demographer. He's a professor in the Department of Demography at the University of Texas in San Antonio. And he's also a policy fellow of the Carsey University of Texas, at the Carsey School of Public Policy at the University of New Hampshire. In 2018, the American Association for Access, Equity, and Diversity presented Dr. Saenz its Cesar Estrada Chavez Award, an honor that recognizes an individual who has demonstrated leadership in support of workers' rights and humanitarian issues. Dr. Saenz, you've written extensively in the areas of demography, Latinos, Latinas, race and ethnic relations, inequality, immigration, public policy, social justice, and human rights. Now you've added infectious diseases. And that's interesting to me because before we started hearing about demography, the pandemic, and then I heard of your work, I had never thought of demographics and coming into play. We're talking about infectious diseases. Now, you're the expert. Can you tell me how you made that connection and why?
Okay. Well, first of all, thank you very much, Professor Rendon, for the invitation. I really appreciate it. And my work has always looked at the Latino population, and in particular, demography is a very, very broad field that includes population change, population growth, and the manner in which populations change, which are associated, for example, with mortality, as well as births, as you have that combination that leads that. So I have done some work on issues having to do with health disparities and so forth, and mortality kinds of issues as well, not specifically with the infectious diseases, but the kind of work that I was doing was very much demographic kind of work, compiling data and analyzing data. So very much in line with the kind of work that I've been doing overall.
Hmm. So how did that lead you to, I know the pandemic was like a major issue going on in the whole country, but what led you to do actual studies involving Latinos?
Yeah, well, what happened is very early on in the pandemic, and we're talking about, by the time we're talking about late March, and particularly what was going on in New York and Boston and other locations, Chicago as well, some of those early kind of places where the coronavirus really impacted the population. And I think that we're beginning to see for the African-American population that there were researchers who were putting out data already that was showing the impact that it was having. but there was very, very little information on the Latino population.
Mhm.
So that's when I had found from the Black Lives Matter, there was a particular document that they had that had the links to each of the state portals that had, and at that particular time, there were only about 10 or 12 locations throughout the country that were providing data on the basis of race or Latino origin. So I went there and I visited every week or so and tried to compile data
Mhm.
to show what was going on in the Latino community. And as we've talked about, Armando, early on, it was very limited information, and the whole thing of the way we defined Latinos and how we're defined, for example, with the Census Bureau, the Office of Management and Budget, where we're not a race, we're an ethnic group. So that made it very difficult because in many of the states at that time, and even today, I would say there's probably about a third of the states that do not uh, disaggregate Latinos from the racial category that they identify with. So that in states, for example, where Latinos identify as white, for example, uh, Latinos are double counted as Latino, but also as members of the white population, and that makes it very difficult to kind of compare the two, because if you're including Latinos who classify themselves as white, it seems to indicate in those particular states that whites are dying at higher rates than they actually are, but it's because you have the Latino population in there. But what I have done is from the time early on is I was able then to just concentrate on the Latino population, and that way, and in particular looking at states throughout the country where we were able to determine where it was that there were the hot spots that were occurring and so forth. And at the aggregate level, uh, there are states again that provide information that distinguishes the two, whites and Latinos. And some of the latest work there that I've been doing has been showing that Latinos and African Americans are dying at rates that are over 3 times higher than the white population. You see that in the Native American population, about 2.5 times higher. And even with the Asian population, despite having higher socioeconomic levels, dying every year much less than the white population, even Asians are dying at about rates that are about 30% higher than the white population.
That's an issue that really got my attention. You issued a report, I think it's been about a month or so ago, uh, which got attention of some news outlets, and somehow I got a hold of it. And it's titled, "What Do We Know About COVID-19 Infections and Deaths Among Latinos?" And that's what you point out, the fact that um, uh, Mexican Americans and Latinos, are seem to be having less deaths as such, so they're underrepresented
Mhm.
in that regard.
Yeah,
But you said that they're also overrepresented. I'm trying to find the reference here.
yeah,
Um, they're actually overrepresented in regards to the infections.
yeah, yeah,
But you're also saying that we don't have enough information about real infection rates among
right,
Latinos, so we don't know the whole picture.
yeah, yeah.
And so
So
that, I mean, that's kind of a quandary, isn't it? I mean, we're
yeah. So first of all, in terms of the early, and this was, I think, the first report that I did that was published with Latino Decisions, and at that particular time, I think that was in early May, and it was showing that as I was doing the analysis of all the states, and it was showing that almost in all the states that had data for the Latino population, that Latinos were overrepresented among people who were contracting the coronavirus relative to their presence in the populations of those states.
right.
And then early on, it was showing that there was only one state, and that was the state of New York, where Latinos were overrepresented among people who were dying from COVID-19, which tended to be kind of a paradox,
Right.
that we were dying at a much higher rates with, excuse me, catching the virus, but we were less likely to be dying.
Mhm.
And what was going on there is the youthfulness of the Latino population, that we're a very youthful population, median age of 29
Mhm.
versus the white population 44. One third of Latinos are less than 18 years of age,
Wow.
with the white population 20% or 65 or over. So
Mhm.
that was what was going on. And once early on, I found data for the state of California, the city of New York, and somehow also the state of Utah, that had the data broken down by age and how people were dying. And once you use demographic kind of techniques to adjust for age differences, that's where it was very obvious that that once you adjust for the age differences, that Latinos were dying at rates that were much higher than the white population. So that and that is because so many of us are in the younger age categories. But once, now that we have the data broken down by age and so forth, you see that
Mhm.
particularly in the age categories from 15 all the way to about 64 or so, Latinos are dying at rates that are, and you're comparing now people of the same ages, whites to Latinos or African Americans to Latino to whites. Now we're seeing that in some of these you have Latinos that are dying at rates that are about 8 or 9 times higher. And that has to do, I think, a lot with, from early on, it was very obvious that Latinos and African Americans were more likely to be working on the front lines, people that were working in meat packing, people that were working in grocery stores, people who were shelving product, groceries and so forth, and agriculture and so forth, when they were exposed to the coronavirus, much more so. And whites were much more likely to be able to work from home. That early on, the Pew Research Foundation Center was saying that people of color didn't have the luxury to be able to protect themselves and work from home.
Right.
Yeah.
It seems to me that uh, also just getting information to our population group may be more difficult. I'm sure the Spanish language media,
Yeah.
we're getting the word out, but uh, if we don't have access to that, or because of job schedules and whatnot, we don't get to see that information, or it's not drilled into us enough, that, or hasn't been drilled enough into us enough, that you have to wear a mask and you have to wash your
Exactly.
hands.
Yeah. Yeah.
That's probably contributes to, so I think to some extent.
Hmm.
Um,
Yeah. And
well,
especially early on, where there was limited information, there was so much confusion. I mean, this was a total life-changing event that was taking place right before our eyes, and people were trying to adjust and so forth. And then, of course, we have the misinformation that President Trump was also promoting and so forth, and at various states down into state levels and at the community level and so forth, that there was a lot of misinformation that was also being presented. And then the push that was also going on in terms of opening states up for business and so forth was another
yes.
major push that tended to make the case that it was not as worse as we were being led to believe, to try to open up the economy. And I think that we saw in July, when we had the first big major spike, that was as the economies were opening up, and it was again people of color, predominantly Latino and African Americans, that were the ones that were greater exposed. And we saw those spikes that were taking place in California, that were taking place in Arizona, that were taking place in Texas, that were taking place in Florida, and these other locations where we were seeing those early kind of business opening up. And in many respects, it has again have been people of color that have been put on the front lines. In some respects, we have been the cannon fodder that has kept the economy going, and so forth, and at the same time putting our lives at risk. With those kind of situations where Latinos and African Americans and also Native Americans as well, that these are people with pre-existing conditions
Yes.
that also put them greater at risk. And in the case of Latinos in particular, a high proportion of Latinos do not have healthcare insurance. In the US, 26% of Latinos 19 to 64 do not have healthcare insurance. In Texas, it's much higher, 38%. So you have all these risk factors that are associated for people of color, particularly Latinos.
I want to get to that, especially with Dr. Perez, who will be joining us, I hope. I think he has some really specific thoughts about that. But you point out an issue that in terms of having access, I think you have like 4 or 5 or 6 points that you raise in this report, and it lays out the age structure of the Latino population. That's something that it doesn't jive with the rest of certainly the majority population.
Right.
Now, did you understand that before? I'm not questioning your background, but was it something that you're aware of that could have impact in this regard?
Yeah, because in terms of the demography, when we're looking at births, where we're looking at all these factors, we know that the most important factor that is associated with kind of differences that we see across groups, for example, or countries or states or whatever the case may be, is the age structure of the population. So that, for example, just to give you kind of a crude example, would be if we compared, for example, the death rate, just the number of people who died per 1,000 people in the population of a country, let's say like Spain, that is a European country, advanced and so forth, and then a country like Mali, for example, in Africa, a very poor country, and we just calculate the crude death rates, and it is likely that Spain would have more people dying for every 1,000 people in the population compared to the country of Mali, but that has to do with the fact that that Spain is a very older country, where you have about 24% of the population are 65 and older. In Mali, the population that is 65 or older is about 3% or so, because it's a very youthful country. So those kind of things in terms of tools to try to adjust for those differences is the age structure in terms of controlling for that. And then you can make comparisons very, very clearly, because you've eliminated that possibility.
Right. Okay, it still raises a question in my mind about the impact on Latinos, and in terms of the present. Obviously, there's a tremendous impact, but long term, I'd like you to think about that. But what I wanted to ask you was, before we get to that, is how many Latinos, using that term, whatever it means, are being missed, actually not being counted because they're counted as white or even as black. People coming from Cuba, Dominican Republic, and what have you.
Right.
They're listed racially, but ethnically, in terms of ethnicity, they're not. So we're missing that kind of information.
Yep.
How do you make up for it, or can you?
Right now you can't, for the most part, because and what you're seeing is where I think for the most part the information has gotten better for mortality, for people who have died and so forth. But early on, there was a lot of misinformation, particularly because of the times that we're in, that if a family member, for example, is hospitalized and people who were dying, the relatives weren't there in the hospital with them. So if the person died, for example, the death certificate was being filled out by a physician, by somebody else that didn't know the person. So they're coming up with kind of estimates of what the race or whether a person is Latino or not. So there was a lot of misinformation. But where we're continue to see much more so is in terms of the people contracting the virus. That continues to be one. And there are particular states, and my state of Texas is the absolute worst.
Mm.
And I'm not, when I'm going to make this statement, I always preface it by saying that it sounds like I'm exaggerating, but I'm not. About up to about a month ago, there were still about 93% of cases of COVID that that did not have Latino or non-Latino or a race identifier. So you see a lot of the majority of those cases still we don't know. So we know that the situation is really, really bad in terms of the devastation in the Latino community, but it is likely that it's even much worse than that we're seeing. And to give you an idea, is here in Texas, for example, Texas continues to be the only state where Latinos account for over 50% of all deaths. And in California, California continues to be the only state where Latinos account for over half, and it's probably now about 60% or very close to all the people who have contracted the virus in the state of California.
Wow,
Yeah. Mm-hmm.
that's incredible. And you noted in your paper that you used the word of a time bomb.
Mm-hmm. Yeah.
You have a prospect of a time bomb that could potentially result in rising rates of infection and death among Latinos.
Uh-huh.
It's already
Yeah.
quite high, much higher than it was back in May or
Yeah.
in March when you started those first, 3 or 4 months.
Yeah. Yeah.
Has that time bomb gone off yet? Or
Yeah, because keep in mind that report that you're looking at, it was published in May. So the time bomb that I was talking about was the jails, for example, people in jails, in prisons, in detention centers, that we've seen that those kind of hot spots that continue to take place. And at that point in time, we were beginning to see some of the nursing homes also that were another of these places where people were concentrated. They were overcrowded in those particular areas, and those time bombs, I think, did take place, particularly in the nursing homes, in jails and prisons, and in the detention centers as well.
you mentioned earlier about um, the rush to open up the economy.
Yeah,
That meant, Latinos going back to work,
exactly.
restaurants, in California, most of the people preparing the food and serving it, are Latinos. And it's true of, many other states in the Southwest.
Exactly.
So it seems that once we started to move, in terms of the administration's demands on that, it maybe it maybe updated the time bomb
Right, exactly.
even more
Yeah.
than we had figured on. So
Yeah. Yeah. And
now
yeah, go ahead.
no, go ahead, sir.
And we were seeing also the outbreaks that were taking place at that time in April and May, the outbreaks that were taking place in meatpacking industry, and in agriculture and in other of the food processing kind of areas that we're seeing these particular outbreaks. And in case of the meatpacking, where people are working so closely to each other that it was difficult that the spread was just immense that was taking place. And there was also the pressure to keep meat processing going. If you remember, President Trump was saying that he was demanding that the workforce be in place to keep the meat availability
Right.
in line.
And of course, one underlying issue is that those essential workers get paid maybe $8 an hour if you're lucky.
Exactly. Mm-hmm. Yeah.
Yeah, that's
Yeah.
sort of a policy issue, but it certainly is related here when you talk about essential workers.
Yeah,
I
and then
recall seeing just the
yeah,
other day the order from Governor Newsom here in California that non-essential workers could stay
uh,
home,
uh-huh,
but essential workers had to do their thing.
yeah,
Um, how many of the essential workers have a computer where they can do their job and not put themselves at risk.
exactly, yeah, and
These are real concerns, right?
yeah,
And
and we're seeing now we're in the second wave or so that we're seeing the major upticks in the infections that are taking place, in the deaths as well, so that there is likely again we're seeing kind of um, uh, here in San Antonio, we've been talking about, I think bars opened up maybe about 2 weeks ago or so. And there is talk now that there's the possibility of shutting those down and so forth. And the governor here in Texas, Abbott, Governor Abbott, there was a um, editorial that the San Antonio Express News had here that was saying that at the time that the virus is roaring, uh,
Mhm.
Governor Abbott is barely whispering in terms of
No.
that he has been saying that he's not going to close the businesses or anything like that. And I think that we're going to see kind of those upticks that we were seeing in July or so that are going to reemerge again at this particular point in time. And one of the things that
Mhm.
is also that is a risk factor and that's muy triste también is that a lot of the essential workers, for example, we know that in the Latino community in particular, but also African American and also Native Americans, that we have a greater portion of people that are in multi-generation homes and so forth, so that there may be 3 generations, los abuelitos, the parents, and then the children in living in the same home and so forth. So you have essential workers that may contract it and then they bring it home, and the possibility of spreading it to people who are particularly even at higher odds of dying from it or become seriously ill. That's the same thing with schools. As schools have opened and so forth, is another of those risk factors that if kids catch it and then they bring it home. And of course, we know that many of these kids, or even with adults, that there's the asymptomatic, that people aren't showing symptoms and you don't think you have it, and then you bring it home and represents another of those risk factors.
So we have a couple of questions in the chat.
Okay,
And I think they're pretty good questions. The
okay.
first one is what do you think the long-term demographic ramifications of all this could be for the Mexican American and Latino population?
Okay, that is an excellent question. And there is so many ramifications that are taking place. One is in terms of the job loss that we've seen. We've seen a tremendous loss of jobs, but particularly with Latina women. We've seen the number of jobs that have been lost. The exit of women, and in particular Latina women, and the pressures that we see in terms of the homeschooling, the caring for aging parents and so forth, that has put an overburden on Latina women as well as African American women and so forth. So the extent to which we're going to see the recuperation of those kind of jobs and so forth is going to take a long time. We know that some of the jobs that have been lost may no longer be there, or if they resurface, it's going to be much, much more limited and so forth. So there's going to be the possibility of job loss. Housing is another of the major things, that there are some laws and so forth, practices that have tried to keep people from being evicted and so forth. But as we go further on down, though that kind of safety net is going to get thinner and thinner, and more people are going to be at risk of being evicted from their homes or not being able to pay their mortgage. I think in terms of the population, kind of the growth that Latinos have been experiencing, that we had been the population that has been really the engine of the U.S., not only the U.S. economy, but also in terms of its population and so forth. And we had already seen a major slowdown of the population growth of Latinos with the major decline of immigration from Mexico to the United States. The volume has dropped about 60% in the last 10 years. We've seen the births in the Latino community that went from 2.9 in about 2008 to now about 1.9. And now the impact of COVID, the large number of people who are dying and so forth, is even going to slow the population down even more so. So these are major challenges, and I think that another important point is also that we don't know for people who have recovered from COVID, we don't know the long-term consequences, the extent to which it'll continue impacting their bodies and so forth over the course of their life and in the coming years and so forth.
Thank you, Rogelio.
Yeah.
I want to introduce Dr. Julian Perez. And Dr. Perez, a colleague of yours in the demographic field, Rogelio Saenz, has been bringing us up to date on what's happening to Latinos because of COVID. And you have a particular perspective. Let me introduce you properly and read a short bio. Dr. Julian Perez has been with CMAR Community Health Centers in Seattle, Washington since 2007. He graduated with a bachelor's degree in zoology from the University of Idaho and earned his Doctor of Medicine degree from the University of Washington School of Medicine in 2004. He completed his family medicine residency in 2007 and his sports medicine fellowship in 2016. He is board certified in family medicine, sports medicine, and musculoskeletal ultrasonography. I've been practicing that, sir.
Too many letters after my name.
You're right. Now you're actually on the front lines. I mean, you're in the hospital, I assume, and you've been taking care of patients today.
Hospital, inpatient care today. Yep.
You're ready to go back, I assume.
In 20 minutes.
We'll make this really quick. No, I appreciate we appreciate your joining us.
My pleasure.
Now, one other thing that I picked up from your bio was that it says your philosophy of care is that healthcare is a human right for all. He believes that the work of primary care physicians is to ensure the health and well-being of the people of our country. He's an advocate for universal health care for all and supports the community health center model as the instrument for achieving this goal. It actually touches on some of the things that have come up, some of the facts that have been covered by Dr. Saenz in terms of the impact that this has had on the Latino community, particularly. And can you tell us, first of all, like what your experience has been over the last several months, and whether you even expected ever to have to deal with this kind of situation? Oh, you have to be unmuted, Ernesto.
He has. I think he has to unmute himself.
Gotcha. Okay, sorry about that.
Okay.
Yeah, I'm still throat clearing. Look, I'll be honest with you guys. I'm recovering from COVID myself. I became sick 3 weeks ago, and it was probably not having to do with direct patient care, but we've got so many people in the community that are sick with this virus right now that it crept into our workplace, and probably I was exposed at work, is what we think. And I'm recovering now, but I tell you what, it's a very scary experience. This disease comes in 2 phases. First phase is the virus, and it makes you feel like you have the flu. Then you start to get a little bit better and you think, maybe I'm over this. Yeah. And then the second phase, you get that inflammation that hits your body, and it starts making you having trouble breathing, drops your oxygen. And if it's not controlled, in certain cases of people that get really sick, you can end up with clots in your lungs, strokes, really bad stuff. This is how people die. We've been seeing this, for 8 or 9 months now, and we knew that it was going to get worse this winter with people going inside their homes. But how did it go from Wuhan to the West Coast to spreading it all throughout the country and now exploding. It's because this virus, has to be transmitted person to person. Think of it just like the influenza. If you're around somebody and you're sharing food, holding hands, hugging, having conversations over coffee, all that vapor comes out of your mouth and then starts to spread. This is something that's part and parcel to us as Mexicanos, Latinos. We like hanging out with people. We like dancing. We like, going to the jaripeos. We like getting together with family. We like barbecues. I mean, I can't imagine, right, life without that type of interaction with my friends and family. And it's exactly those social relationships and that cultural practice that has made us a huge target for this virus. There's some folks who are just more introspective, homebodies, don't get out much, and are perfectly fine with that. They're probably doing better, not only because they're transmitting the virus less among their circles of friends and families, but also because they're able to quarantine, they're able to keep away from the virus now with not as much impact on their social and emotional lives. And we have a lot of patients who, God, they talk to their mom and dad every day on the phone. They go to Mexico, every winter to visit. And they travel 2 or 3 times a year for vacations. All that stuff's on hold now. And it puts a serious dent in your bank account of energy and emotional reserve. So, además, hay gente que hablan puro español. Some of us only speak Spanish, and some of us only read in Spanish. And a lot of the public health information is in English. Some of us are not good with computers and internet. And so that's another barrier potentially to being able to be well informed about public health best practices and how to stay safe and healthy. And then, if this virus creeps into your house, how do you isolate yourself when you're sick? Okay, I mean, I have a house with 2 bedrooms and 1 bath with my daughter and my wife. And I got sick and I had to go to the basement, but it's an unfinished basement, guys. I don't have a bathroom. And so I was using one of those, REI totes where you go poop in the woods, I mean, that's what I was using, right? For 12 days. And it's not easy, but those little sacrifices and that preparation that we made, because I had been on 4 quarantines before I got sick. That means I was exposed 4 different times, and I had to go for 14 days, checking the list of my symptoms, taking my temperature twice a day, making sure that I didn't get sick from those exposures. Over 4 times of doing that, we had things really well prepared in our house. So we knew how we would isolate if it came to that. We had some basic medicines ready. We have masks and gloves in the house, with hand gel. Right. And my sister dropped me off an oximeter to check my oxygen. Thermometers in the home, these are real basic things that people need in their homes nowadays, so that they can be prepared and they can protect their loved ones. Case in point, I just had a patient this morning. She came to work and she got sick, had a little bit of, she just said, I just felt warm for the last 3 days, guys. I'm not sick, I just feel a little warm. And every time I had my temperature checked, it was normal. Well, she got tested today and it was positive. So now what? Gosh, yesterday she said she was eating friends with her coworkers and they were just yucking it up and laughing and, spreading that virus. These are things that we love to do, but they're dangerous.
I would add another aspect to the reasons that some people can deal with, staying at home, and that's fear. Yeah. I mean, I'm scared to go out. I live in a community that's fairly, it's pretty intelligent, and what people here kind of have common sense. So I see most people wearing masks. Good. I think they're all scared too. It's like the way you describe it. It's it is a deadly virus. I mean, it does kill you, or can kill you in its worst forms, I suppose. But I wanted to touch on something that in your bio, which really struck me as very important, and that is the notion that the healthcare that many of us are not receiving is a human right. And I totally agree with that. I wondered if you can, kind of elaborate on what you mean by it, and really what it would mean to have this kind of, agreement among all the people in the United States. We have this notion that, it is a human right. Everybody should have healthcare. Can you kind of expand on that?
Well, sure. I mean, if you decide that health is a human right, that means everybody within your borders gets health care when they get sick, no matter what. And very importantly, gets preventive care to stay healthy. We invite people to this country to work, right? To come do our worst jobs, things that no one else can or wants to do. Butchering the cattle, killing the chickens, harvesting the apples, digging the ditches. This is hard work. And those essential workers, they've always been essential workers, right? Deserve every protection and every service to stay healthy and be able to do their jobs and live dignified lives and take good care of their families, as those of us who are lucky enough to be citizens. I'm a citizen. My mom and dad were from Mexico. They busted their butts in the fields to give us a better life. And here I am, a doctor taking care of my community. I'm happy. I'm thankful for their sacrifice. Doesn't mean that they never deserved good care. They never got good care. I mean, they never got any care. My grandma had 22 pregnancies. 16 of her children lived. She lost 6 of her children in childhood. That's terrible. That's terrible. It's unacceptable. But anyway, health is a human right. What that guarantees you is that in times like pandemics like now, if everyone's being taken care of appropriately, they're much less likely to be spreading the virus. That same philosophy that health is a human right, health is not just medical care. It's not just health insurance. It's also the ability to work in a safe job. That means that if you're in a factory that has you completely side by side like that, swinging big knives, can get people spaced out, give them the masks, give them the gloves, give them the batas, make sure people have what they need to be safe in their jobs. It's not just doctors that need this stuff. It's our essential workers everywhere. And if you believe that people have a right to be healthy and safe, that should permeate throughout the community. And we could have kept this virus much better suppressed. Instead of now, where it's the winter, it was predicted that it was going to get worse. We could have gone from 100 cases to 1,000. Now we're like from 25,000 to 180,000 a day, guys. This is out of control. This is a public health heart attack.
And Chris, you're touching on an important policy issue that, has put off for a very long time, and that is the issue of universal health care in the United States, adopting it as a norm, which I think it should be. Anyone who has seen, I think, the kinds of things that you've been dealing with would certainly agree. And I have to tell you that the service that you're doing is something that is, well, you probably don't like the term that is, courageous, but not everyone can do it. Not everyone is willing to do it. So we have to thank you for that.
Appreciate that. And the best way to thank us, guys, is to wash your hands, keep your distance, and wear your masks. Because the hospitals are filling up, and it's getting very hard for people to take care of all the patients. Human beings, we're human beings. We need to sleep, we need to eat, we need to use the restroom. I tell you what, I have friends on shifts for 12 hours, don't do any of those things in 12 hours.
We have a couple of questions. I want to be really cognizant of your time, Dr. Perez. You appreciate everything.
15 minutes, I'm good.
Okay. So, and then I have a question specifically for you, and then I have a couple of other questions for Dr. Saenz also. What outcomes do you see with alternative medicine? That's for Dr. Perez.
So my definition of alternative medicine would be anything that's not under the typical Western medicine model, like antibiotics and hospitalizations and physical therapy. We get a lot of questions from our patients in the Mexican and Spanish-speaking communities about what herbs, what remedios caseros can they use to improve their health, to protect against COVID, or to treat themselves if and when they get COVID. We know that the virus is, there's no cure that we can see. As far as, the herbs and traditional practices that we have to stay healthy, if you were to get sick, a lot of people rely on the inhalations, the vapor inhalations with some eucalypto. That tends to be really good. I did that, and it really helped to bring up the phlegm and keep me from, developing a pneumonia, I think. There's a lot of different teas people drink. Some of our patients would do manzanilla, which is chamomile tea, along with diente de leon, which is dandelion leaf. And they felt like that helped to stimulate their bronchi to cough out this phlegm. And anything that can give you just overall good health should be continued to be practiced. Everybody does different things to make themselves healthy. And a lot of those are under the alternative medicine category. Praying, absolutely. People are very spiritual. If you have a healthy spiritual life, and faith in God, that goes a long way to getting you through a bad illness. I probably 3 nights during my illness, I prayed that I would wake up in the morning, and that was no joke, and I'd never done that before. So there's a lot of different things that people can do to keep healthy and to get them through this if they happen to get sick.
Thank you, doctor. That was a great answer. Yeah.
Yeah.
Thank you for sharing that. For Dr. Saenz, there's actually 2 questions here that kind of dovetail into each other. The
Okay.
first one is what are the data or added I'm sorry, I'm having a hard time reading
Sure.
this. The data attitudes towards vaccines. I think they're talking about particularly in our community, and what are factors that might impact access to vaccines, such as healthcare or immigration status. And then the second, what I would call the second part of that is there historical data for Mexican Americans or Latinos who use alternative medicine?
Yeah, I think this might be more a question that would be appropriate to Dr. Perez.
Okay.
Perhaps because I don't have information regarding attitudes toward vaccinations, as well as the other having to do with alternative healthcare. I don't know if Dr. Perez,
Sure.
yeah.
Sure. So the vaccine, I often talk to people on the radio. We do radio every day. And one of the biggest things that we're trying to do is to make sure that we cultivate the trust of the community. Because when people don't trust, you're not going to get them to do anything that could be evidence-based or excellent to control this pandemic. And so our community in general has pretty good trust of vaccinations. We all take our kids to get vaccinated. There's usually not a lot of question about that. The flu shot is an outlier. A lot of people don't trust the flu shot, or they say, I get it and I get sick every time I get it. We try to give education about that. But with this COVID vaccine, there's a lot of disinformation out there on the internet. A lot of our patients use Facebook. Not too many use Twitter, but a lot of people use Facebook. And there's a lot of garbage on Facebook, guys. People saying that this COVID vaccines are going to kill you. And there's ones that say the flu shot this year actually has the COVID vaccine in it, and they're not telling you. These are just based on nothing at all. There's based on no evidence whatsoever that those are true statements. And so we are moving forward and vaccinating all the patients we can against influenza, because that's still a disease that kills 60,000 people a year. I've had it twice. It's terrible. I never want it again. And the COVID vaccine, we are going to follow the process, follow the science, and make sure that this is what seems to be at least 2 companies now have got candidates that they say are 95% effective. And now all that data they've given over to the Department of the National Institute of Health and the FDA. They have to review all the data and make sure that it's safe and effective. And if it looks like it is, they'll then apply for emergency authorization and they'll start to vaccinate people. The US government, NIH, and most of the state departments of health have agreed that the two groups that will get vaccinated immediately are the doctors, nurses, and healthcare workers in the hospitals and clinics. And then the second would be the people that are high risk, and that may be based on age or chronic diseases that they have. After that, I think it's open for discussion. And there are a lot of people in the country that are arguing and saying that we need to have an eye on those people that are most vulnerable, that suffer the most. And we know that Latinos will get anywhere between 3 and 6 times as much disease as the white community. We may die in 3 times as much instances when it's adjusted for age. And so there's a strong argument to vaccinate the people who are dying from this, because that's essentially what we're trying to do. We're trying to save lives here. The African-American community, they're getting nailed by this. So many African-Americans are dying in Detroit, New York City, Chicago. And then the Native Americans, even worse. Their numbers are even worse. So I think what's going to happen is that they're going to look at people that are in essential jobs, people that are on the front lines, not just in the health field, but also in industry, agriculture, animal husbandry, mining, logging. And they're going to say, if you got to be out there working and you're possibly going to be exposed and transmitting this virus, then we can A, protect you and your families, and B, we can stop the transmission. And that's going to be really important.
That was going to be my closing question to you all, because the issue has come up in the public forums that once we get the vaccine, now it looks like we're very close to it. How is it going to be distributed? Who's going to be the ones who get the vaccine first, so to speak? And what you described sounds, makes a lot of sense to me. We talked earlier about the difference between essential workers and non-essential workers. The non-essential workers can stay home and work from their computers.
Mm-hmm.
Essential workers can't. They're the ones that go out and essentially they're the ones that not only get sick, but they spread it.
Exactly.
And that's and when you have that kind of situation, it seems to me makes a lot of sense to me to say that those are also the people that should get it first.
I agree with you.
Yeah.
And if there's an age seniority of some sort, I welcome that too. But that seems to be, where we are right now. And Dr. Saenz, do you have any comments on that in terms of the distribution and so forth? I mean, there's got to be some numbers involved there.
Yeah, in terms of you look at in terms of the essential workers, I think we've seen disproportionately that it's people of color, in particular Latinos and African Americans, that have been on the front lines as essential workers and so forth. In the healthcare field, there are a lot of people also that are in the field, particularly with nursing and a variety of other kind of jobs. And in terms of the other group having to do with the pre-existing conditions, we know that Latinos are disproportionately overrepresented among people with pre-existing conditions. Where we do not fall in line is with respect to the elderly population, the older population in the Latino community, 7% or 65 and older. But as Dr. Perez mentioned, that there's going to be kind of you have the connection between the pre-existing and the older ages, and how those among those two groups will be distributed in the priority areas that is going to take place. So in certain respects, I think in 3 of the 4 categories that have been put as kind of the priority areas, I think that Latinos in one form or another are going to be, theoretically, because we don't know what eventually will happen, would be among the people in the front lines as essential workers, a good segment in the healthcare industry, and people with pre-existing conditions.
Quick question with regard to school children, kids under college age and so forth. For me, there's a connection between kids going back to school, and in some cases, we've seen too early, too soon, too quickly. They go out in the streets, they're kids, they might have masks, but they run around and falls off, whatever. And there's a possibility that because of that, and if they bring it back home, and we're talking about earlier, Julian, about Latino families tend to have, be multi-generational.
Yep.
Right? So you'll have, grandparents, parents and kids. You might have, in-laws and what have you. So it seemed to me that it would also make sense to target young people so they could go back to school, right? But not bring back the COVID into the household. I mean, does that make sense?
So I guess the rationale here is that this is a virus, when it first came out, that we were seeing 5% mortality. Now we're seeing probably around 2%, 1 to 2%, based on the region that you live in, because medical care is better, protocols are better, we know more about the virus now. That's still a tremendous amount of death and suffering compared to an influenza season. And so with influenza, we used to say, there's priorities for where people get vaccinated based on who could suffer the most, have the worst outcomes. Now we just say everybody gets it because it's such a proven method to prevent the illness. In smallpox, in the case of smallpox, the way they eradicated smallpox from the world was not to take a look at the people who are most likely to die, because this smallpox disease was pretty bad. It killed pretty evenly. Everybody that got it, had a bad chance of dying. But they focused more on the people who were spreading the disease. They vaccinated them first. And I actually have posed this question 2 or 3 times to public health officials in our region to see if they would consider that approach. And they do consider that approach, but they have to prioritize the groups of people that are the most exposed and the most likely to die. If we've already got 1,300 health professionals that have died in this pandemic, that's 1,300 soldiers that won't be back on the front lines. That's a big loss. And if you decimate your army, you can't even have a chance to fight, right? So we got to protect those of us that are in the hospitals and the clinics. After that, I think it's right to protect the people who are most likely to die. Absolutely. After that, my opinion is you go after the people spreading the disease. And those are the folks that are out of the house every day working.
Right.
So we have two. I know we're right at the end, but there are two more questions that I think it would be a very good way to end all of this on. One of them, I'm going to kind of combine them down together. One of the questions basically reads, "What reaches extroverts who still congregate with each other?" Right? Like what is some of the language that we might be able to use? And along with that is what percentage is mask wearing actually helpful and a safeguard? Because there seems to be a lot of misinformation about that.
So I can take the masking. That's a pretty easy one. Masking is tremendously effective. Mostly when we thought at the beginning of this pandemic, wearing a mask was just to avoid coughing and spewing virus or just aliento or babas a tus queridos, a tus amigos, a tus compañeros. And now we realize that it actually really holds that vapor in. It doesn't allow it to spread out and infect other people. It really does keep it very local to your own face and head. And also, we've seen that there's some protection to the person wearing the mask as well to not get sick. And so if everybody's wearing masks, this is well proven around the world. Consistent high percentage mask use keeps this virus under control because it doesn't transmit. We need 95% mask use in our country. That's just the bottom line. We have to have it. You know what we got right now, guys? We got 50%.
Wow.
And if you wonder why we're in trouble, that's why, guys.
Yeah,
50% of this nation wears masks or believes that it's this is a right to not have to wear a mask. I say, hey man, I'm wearing this. I care about you. I don't want to get my family sick. I don't want to get your family sick. Right? We're all in this together. And on the radio, we said all the time, juntos venceremos. We are not going to beat this thing unless we act together.
Exactly.
And there's a huge divide in this country. It's very unfortunate. And there's a transition of power. Hopefully will occur soon. Some sore losers out there having trouble admitting defeat. But this is the bottom line: is we got to get together. We're Americans. We're Mexican Americans, and we care about our families. So let's act like it.
Yep.
A ver, la
Completely.
segunda pregunta.
Rogelio,
Sí.
you wanna ask Rogelio?
What was the second question?
You want to add something, Rogelio?
No, I'm in completely in agreement. I think here in Texas, Dr. Perez, it has been a major kind of challenge in terms of that you see a lot of people out and about without masks and so forth. And then I think the Governor Abbott has not really provided much guidance. I think that I was mentioning earlier that the San Antonio Express News was talking at the time that the virus is roaring. Our governor is barely whispering with any kind of masks or all these kind of things that are proven to protect.
Sounds like Governor abdicate as opposed to
Yeah,
Abbott.
sí, igual. Sí.
I like that.
That's our time, Profe.
Okay.
Thank you, Ernesto. Dr. Saenz and Dr. Perez, thank you so much for your time. We may, have to come back later, maybe this year or beginning of next year, and have you back, because what you started, Dr. Saenz, in terms of the data gathering, and Dr. Perez, the kinds of insights you give us are so valuable. Thank you very much, and we'll see you another time.
Thank
You're
you very
welcome.
much. Y
Welcome.
buena suerte, doctor.
Juntos venceremos, guys.
Dale, pues.
Chao,
Hasta
chao.
luego. Adiós.
Adios.